We cross over to the Pharmaceutical Society of Kenya is this morning speaking on the Health Laws Amendment Bill 2018. Now, the pharmacists are calling for the involvement of professionals in the legislative process. And Namukabu Werunga is covering that story. And we're now crossing over to Hurlingham here in Nairobi, where they are talking about the same. Let's listen in.
Oral submissions to the health committee, but this never happened. As you all know, this is against the spirit of public participation under the Article 10 of the Kenya Constitution that reads in Article 118, where we as stakeholders should be engaged to uphold public participation and interest. Specifically, we are aggrieved by 3 amendments in the section in the health amendments laws. That's section 3 that removed the representation of the Pharmaceutical Society of Kenya, pharmacists, from being members of the Pharmacy and Poisons Board. 2, section 35 that abolishes quality control mechanisms, and section 23 that equated pharmacy specialists, pharmacists, and pharmaceutical technologists, removing the element of highest quality of care accessible to all Kenyans as guaranteed in Article 43(1)(a) and Article 46. These amendments, we find them to be in bad faith if taken in wholesale without our consultation. They have watered down the professional role and responsibility in the supply chain, particularly even the amendments that were done to the KEMSA Act, where we see KEMSA being a distributor, just like any distributor in Kenya, but being a national distributor, should have a pharmacist as the head of the institution, because they are the technical one who has the technical responsibility and has taken the responsibility of upholding quality of medicines in this regard. To this end, I think you have seen in the media the various seizures of contraband medicines by the Pharmacy and Poisons Board at our various points of entry. We have also seen a rise in Kenyans dying from cases of non-communicable diseases like cancer, diabetes, and hypertension. So we are asking ourselves as Kenyans, we know that these diseases are majorly intervened. The major intervention is medication. And over 90% of the cases, medication is the major intervention route. Are Kenyans taking fake medicines? Yeah? Are Kenyans receiving fake services from fake practitioners? So we are asking, where are the laws on this? And when we ask those questions, when you ask those tough questions, we find that there are members of parliament, if this is in a public domain, who have interest in the pharmaceutical sector and have been sequentially since the 11th parliament removing the roles of pharmacists, professionals, in upholding ethics and quality of pharmaceuticals in this country. So we are calling to the president, who in Meru made the following statement. In Meru, the president, His Excellency, mentioned that we now have teachers impregnating students, preachers who swindle the flock, lawyers who defraud clients, architects building houses using shortcuts leading to collapsing of buildings, doctors giving false diagnosis to increase their fees, and pharmacists selling fake medicines. So we are imploring on His Excellency, if you want the agenda of universal healthcare coverage to be a success, you need to have professionals in the Pharmacy and Poisons Board and quality upheld. These 2 have been removed from if we go with the wholesale of the amendments that have been done today, these 2 have been removed. Professionals have been removed and quality aspect has been removed. We also called to the chair of the health committee. She has done a great job. In the last parliament, she was in the education committee, and she did a great job by bringing people together. We call on her to bring us together as professionals, and we can bring insight into her committee to be able to give Kenyans quality and affordable medicines. We also call to the Director of Criminal Investigation and the Director of Public Prosecution to look into the matter of legislators who may be having personal interests that are in conflict, where they are passing laws that are in conflict of public good with their own business interests. And we therefore call for the slowdown of this process and call for consultation to happen, and we can register our professional input, and so that we can hold healthcare of the highest quality attainable as per Article 43(1)(a). Asanteni. So, something else?
All right, thank you so much. Maybe in summary, you could just give us a little insight on what has been happening lately in the country about sugar, the issue of mercury, lead. Is it possible that it can be incorporated in sugar, and what effect does it have on the health?
So I'll start. I'll leave to my honorable fellow here to talk about the effects of lead and what have you, if indeed they are
actually
there. So it's okay. So let me start. Okay. Then I'll leave to you. So this matter of contraband products coming to the country, it's a grave concern. It is one thing to get contraband clothes into the country. Yeah. What we are doing is we are exposing our public to ills. So first, the country is losing taxes, and Kenyans, when it comes to now things where medicines and even things like sugar are laced with, sugar is laced with copper and mercury, as we hear, but more so even in medicines, because we're also finding medicines coming in. As you saw in Eldoret Airport, there was a big consignment of medicines that were confiscated and they were found to be fake. Yeah. So we find Kenyans are being exposed to these ills. So we condemn this, and we applaud the role that the government is doing in these heightened measures that they're doing right now. But we like to make Kenyans aware there's an issue we have of counterfeit medicines in this country, ineffective medicines. So we call to Kenyans to be awake and work together with the Pharmaceutical Society of Kenya and Pharmacy and Poisons Board, because we run the pharmaceutical distribution chain. Expose this to us, and we'll be able to run ethical and disciplinary committees that bring these people who are doing these things to action. I'll leave to Honorable Fellow to talk about the effects of mercury and lead on the humans.
So actually, of course, the issue of adulterated sugar with mercury is a big issue, but I can actually parallel that with what's happening with the medicines. Medicines, by definitions, are poisons taken in small doses. So in as much as we think about mercury, think about all the medication you're taking. If you don't take it appropriately, it's actually poisonous. The responsibility of the profession, as pharmacy profession, is to ensure safety and efficacy of all this. So when the professionals, the pharmacy professionals are left out in all this, then the safety of medications in general is brought to question. So really you should, one thing that probably most of us don't realize, drugs do not have brains. So you need class professionals to ensure that they're used appropriately. So the big issue is, I'm really concerned about legislations that leave out the stakeholders. We're there, the pharmacy profession is there because of the drug itself. They're the engineers of all these medications. But when you leave them out, and from production to distribution to the use, we need pharmacies are responsible for the entire drug use process, from manufacture, distribution, and use too. But in a way, if you look carefully the way they are being handled, not only do we deal with fake medications, but we also use with misuse and abuse of medications. It's a high time that actually our professions, through the Pharmaceutical Society of Kenya, that's the body that is given the responsibility of upholding ethics. That is the body that is in fact responsible for the efficacy and the safety of medication. So my contribution, as far as the mercury is concerned, not only do we talk about mercury, we also talk about the residues from the veterinary products. I mean, we're talking about the meat that we eat. We don't know how much hormones is in there. These are all issues that the Pharmacy and Poisons Board has been handling for quite a while. But for now, that we're being sidelined for the sake of, I don't know whether it's greed, but because of the business interest. But it's important. In fact, probably my last statement, while I'm sitting there, is in medications are the third leading cause of death. Third, out of the hundreds of diseases that kill people, but medications, to some degree, we are responsible for the deaths that occur. So it's a high time we moved in and make sure that we improve our patients' or population health outcomes.